Listen to that. That was the crowd on Monday night at the Consol Energy Arena in Pittsburgh when Sidney Crosby hit the ice for the first time since a concussion took him out of the game in January. By all accounts, it was a stunning return. 2 goals, 2 assists.
Didn't you just know he'd do something like that?
But let's rewind a mere couple of months to a time when Crosby's return to the NHL seemed a lot less certain. His press conference at the beginning of September.
Good afternoon, everyone. Thank you for attending today.
With cameras flashing, Sidney Crosby sits at a table, flanked by the Penguins GM and 2 doctors. They explain how the star player is recovering from a vestibular type of concussion. Dr. Ted Carrick, a professor of clinical neurology at Life University in Georgia and a member of Sid's recovery team, describes how the injury affected Crosby's perception of the things and space around him.
But one thing that the brain does is it really allows you to know where you are in space and where space is in reference to you. In Sid's case, that was not exactly correct. That is to say, areas of space were not in an appropriate grid to where he would perceive them.
Dr. Carrick goes on to explain how his team helped rebuild Sid's grid to make it more accurate. Basically, to make Sidney Crosby's brain perceive things in the places where they actually are.
We can change the representation of body parts and environment in the brain. We can do that very, very successfully with different types of strategies. And Sid did very, very well. Now, fast forward to Monday, just over 5 minutes into the Penguins game against the New York Islanders.
Here's Crosby with a burst of speed. Up the middle, gets open and scores! Welcome back, Sid!
Hard to imagine that just a few months ago he couldn't tell if the net was actually where he thought it was. Dr. Carrick is known as the founding father of chiropractic neurology. He's also known as an expert in rehabbing brain injuries like Sidney's. We caught up with Dr. Carrick earlier this week at his office in Cape Canaveral, Florida. Dr. Carrick, welcome to Day 6.
Well, thank you, sir. Good to be with you today.
Dr. Carrick, can you elaborate on what happens when a person's environmental grid or map is altered by this type of brain injury?
What happens is some individuals have bad environmental maps. These are people that you probably wouldn't want to parallel park your car, or maybe you don't want your car near them if they're parallel parking their car. For instance, we'll have a baseball player, and if their map is out, they're going to be firing towards the plate, and they may hit the player, or they may be out of the strike zone, and they'll have to learn to compensate. We'll see this in our players from the NFL, where a quarterback will go to hit a target, a running back, and they'll miss that target, or they'll perceive that the player is in a different area than they are. Soccer players may bounce a ball off of the goal because they perceive that that post is not where it really is. And of course, in hockey, it's very, very important because you've got a small target in a net, and you may have to negotiate that past a goalie, but if you perceive that that environmental map is skewed, you're going to be accurate to where you perceive the opening is, and that may or may not be associated with what is real.
So how do you reprogram these mental maps to make them accurate once again?
It's not a simple task. Our examinations are very, very detailed. Our therapies are very specific for an individual, and everything we do, we measure the outcome.
I'm curious about how you measure the efficacy of the treatment. Do you use neural imaging, for example? How do you know that this works?
Well, we use a variety of tools. Certainly we use functional MRI. One of the things we find with higher brain function is that it promotes the ability to stand upright and not fall down. And when people have disorders in their brain, one of the first things that happens to them is a loss of their integrity to stand up correctly. And what we find is that as we improve brain function, we also improve stability. We can increase their speed of walking. We can measure activities of the eyes, and we do it with video where we'll give the patient different environmental targets. We'll put them into spins. We'll put them into what we refer to as perturbated experience, where we try to trick the brain, or we try to make them off balance. And we will look at what their function is, and we may try a certain scenario or strategy and find that it doesn't have a beneficial consequence. And then, of course, we can change it right away. So our therapies are not, well, let's do this for 6 weeks and see how you do. We're very aggressive. We have so many patients to see that we don't have the luxury of seeing them for a long period of time. So as a consequence, we want to do things rather quickly, get the patient better, give him or her things that they can do on their own, have their local neurologists involved when we send them back.
We're talking about therapeutic treatments for illnesses and for injuries, but could we move this out of a therapeutic setting into, say, a training setting, effectively perhaps creating a super athlete?
Well, it's a really fascinating field. We're very, very much involved with it. We see just a bucket full of professional athletes from a variety of sports and some very high-profile athletes that come in to really get some baselines and to learn some strategies to make their game better, whether it be a professional golfer who's just not hitting the ball exactly right, or whether it's an NBA basketball player who's a little bit off his game. We see a lot of these people. Ideally, we can look at kids, for instance, look at how they're playing, what their strategies are, give them some techniques that they can do with their coaches and trainers and families, and really do our best to maximize performance and then decrease the probability of injury.
Dr. Carrick, it's absolutely fascinating work. Everyone in Canada is pretty excited about your most famous patient, and a lot of people in the U.S. as well. Thanks for talking to us today.
Thank you. Very kind, and appreciate it.
That was Ted Carrick, professor of clinical neurology at Life University in Georgia. He was a member of Sidney Crosby's